Imagine your child wakes up tired, complains of joint pain, or gets mysterious rashes, and everyone says it's just growing pains. But what if it's not? What if their immune system is quietly at war with their own body? Today, we're diving into a serious but often misunderstood topic: how to spot early signs of autoimmune diseases in children before they become chronic, life-altering conditions. So let's start from the beginning. An autoimmune disease happens when your child's immune system, designed to protect them, starts attacking healthy cells by mistake. It's like having a home security system that keeps mistaking your family dog for an intruder. Not helpful. In children, this misfire can manifest in dozens of subtle ways, which is exactly why it's so easy to miss. One of the earliest and most overlooked signs is fatigue, tiredness that doesn't match their activity level. Kids are naturally energetic. If your child is completely wiped out after something simple, like a trip to the park or walking around the block, that's not just a bad night's sleep, that's a red flag. You may also notice joint pain or stiffness, especially in the morning. And no, it's not normal for a 7-year-old to wake up with knees that feel like they belong to a retiree. Recurring fevers with no obvious cause? That's another one. If they're getting warm every few days, but there's no cold, flu, or infection going around, it might not be a virus, it might be inflammation. Rashes that come and go mysteriously, especially ones that seem worse in sunlight, those are important to notice too. They're not just sensitive skin moments. And then there's hair loss. If your child starts losing hair in patches, or their hair looks thinner than usual, it's worth paying attention. Now, let me pause for a second. Don't panic if your kid skips brushing their hair and you find a few strands on the pillow. That's not what we're talking about here. I'm talking about persistent, noticeable change, a pattern, not a one-off messy morning. Autoimmune symptoms don't always stop at the physical level. You might notice changes in your child's behavior. Maybe they become withdrawn or unusually anxious. Maybe they're forgetting things they normally remember easily. Or they're having trouble focusing on schoolwork they used to breeze through. And here's a quick gut check moment. When was the last time your child felt truly well for 2 full weeks in a row? If you had to think about it, or can't remember, that's something to take seriously. Some of the more common autoimmune conditions that show up in kids include type 1 diabetes, which involves the immune system attacking insulin-producing cells. Then there's juvenile idiopathic arthritis, basically chronic joint inflammation that just shows up without warning. Celiac disease is another one. It's an immune response to gluten that affects the gut, but it can show up in the skin, mood, or growth too. And then there's lupus, a more complex condition that can affect multiple organs in the body and often mimics other illnesses at first. The challenge? All of these can start with symptoms that look like regular childhood issues. A little tiredness, a rash, stomach ache, which is why so many parents overlook the signs until things escalate. So what should you do if this is starting to sound a little too familiar? Start tracking symptoms. Write them down. Even better, track when they occur and what seems to trigger or relieve them. Then speak up. Ask for blood work. Ask to see a specialist. Trust your instincts, especially if you feel like you're being brushed off. And yes, even if your doctor gives you that maybe you're overthinking it. Look, overthinking is a superpower when it comes to your child's health. Autoimmune diseases in children are real, often invisible, and very treatable if caught early. Awareness is the first step toward protecting your child's quality of life. If you found this helpful, share it with someone who might need to hear it. And if you want more insightful, parent-focused content like this, don't forget to like the video and subscribe to the channel. Your support helps us reach more families with the information that matters most. Thanks for watching and take good care.